What is clinical psychology? Clinical psychology is the area of psychology that focuses on understanding, supporting, and improving people's mental health. It helps explain why people sometimes feel anxious, sad, stressed, overwhelmed, or confused, and what can be done to help them feel better. You can think of clinical psychologists as helpers for the mind. Just like doctors look after your body, clinical psychologists help look after your thoughts, feelings, and behaviors. They work with children, teenagers, and adults to understand what they're going through and to find healthy ways forward. Many people experience difficult emotions at some point: worry before a big test, sadness after losing something important, or anger when things feel unfair. These feelings are normal. But sometimes emotions can become so strong or so constant that they start getting in the way of everyday life. That's when clinical psychology becomes especially important. It helps people understand those feelings and find tools to manage them. One big part of clinical psychology is assessment. This means trying to understand what someone is experiencing by talking with them, observing their behavior, or using questionnaires. It's not about judging, it's about understanding. A psychologist might ask about sleep, worries, friendships, or school to get a full picture of what's happening inside someone's mind. Another major part is therapy, which is really just a special kind of conversation. In therapy, people talk about what's troubling them in a safe, private space. The psychologist might teach skills like how to calm down when stress feels overwhelming, how to challenge negative thoughts, how to communicate feelings, how to build confidence, how to cope with difficult situations. One well-known approach is cognitive behavioral therapy, CBT. It helps people understand the connection between their thoughts, feelings, and actions. For example, if someone thinks, "I'll fail this test," they might feel anxious and avoid studying. CBT teaches them to challenge that thought and replace it with something more helpful, like, "I can do this if I prepare." Clinical psychology also helps with emotional difficulties, like anxiety, depression, fears, anger, or stress. It supports people who have been through tough experiences, such as bullying, family changes, illness, or grief. Everyone has a different story, and clinical psychology recognizes that people need different kinds of support. A powerful part of this field is building resilience, the ability to bounce back from challenges. Psychologists help people notice their strengths, understand their feelings, and learn healthy ways to cope. This doesn't mean making problems disappear. It means helping people feel stronger and more capable as they face them. Clinical psychology also teaches us to reduce stigma. Having mental health struggles does not mean someone is weak or broken. It means they are human. Just like we get colds, sprained ankles, or headaches, our minds can have difficult moments too. And just like we seek help for physical injuries, it's okay and brave to seek help for emotional ones. At its heart, clinical psychology reminds us that no one has to go through challenges alone. There are tools, strategies, and caring professionals who can help. And learning about mental health is one of the strongest steps we can take toward understanding ourselves and supporting the people around us. So the next time someone opens up about their feelings, or you notice yourself struggling with worry, sadness, or stress, remember this: clinical psychology exists to help us heal, grow, and take care of our minds, because mental health is just as important as physical health.
If you enjoyed our channel, please click subscribe.